Hello, my name is Henry Edmonds. I'm a retired pastor. I work with the Alzheimer's Disease Research Center at Duke University Medical Center, also the North Carolina Registry for Brain Health. I want to talk to you today about making caregiving easy for particularly African American caregivers. African American caregivers' well-being is the title of my presentation, and I wanted to just give you about 5 things that to remember that you can work on as a caregiver, particularly as you care for African American caregivers, patients. First one is give unconditionally. Many persons that I worked with when I was a pastor, they had problems really giving unconditionally. They gave conditionally, and giving conditionally is not good for your own personal well-being, because when you don't get what you expect in return for caring, it bothers you, and you get troubled by those things. But giving care unconditionally is really the kind of care that's needed as a caregiver. Live in the present. As a caregiver, you have found oftentimes that caregivers were always thinking about what's going on in the future, what's going to happen if this happens, if that happens. And so if you really want to be a good caregiver, live in the present. Don't worry so much about the past or the future, but do all that you can today so that you make things easier as you go ahead to the future. Swallow your pride and ask for help. Lots of caregivers think that they can do it all by themselves, and they never ask for help. Asking for help does not make you a bad caregiver. It makes you a better caregiver. So ask for help, and rely on that help to help you to do the things that you need to do as a caregiver. Practice personal devotion or meditation. I had a person that I was pastoring who had actually a kind of a shrine set up in the middle of his living room, where he went to every day, every morning, and had his own personal devotion and caring as he got ready to care for his loved one. So whether you put a shrine in your living room or whatever you do to take care of your own personal needs is good. So practice your own personal devotion or meditation, whatever it takes to put you at ease so that you can do the job of a caregiver. Think positively. Think positive, not negatively. Think of those things that you can do today to make your job easier for tomorrow. Lots of times caregivers will focus on those things that are way out in the future. It may happen, may not happen, but it's important that you think positively and do those things that you can do today to make your job easier today as well as in the future. I have a letter that I wrote for my wife. I'd like to read it at this time. It's actually written in the first person. It's written for my wife so that she would know how that I felt about what she was doing as she cared for her father. I titled the letter, I Had to Cry Sometime. I never wanted to move my daddy into a nursing home. I knew that he would not ever want to live in a place where he saw people that he didn't know or faces that he didn't have confidence in. I knew that also that Daddy would never want to live somewhere where he didn't know those people or or how to get around in the place where he was. 10 years I had cared for my daddy at the home with help from a nearby nursing home. But the day care center closed and we couldn't leave him at home alone, so we had to put him in a nursing home. Time passed and I was there every day. Every day I washed and ironed his clothes. I sat with him through his silence of his personal sundowns. I know that if I had left him while he was asleep, that he would not even remember that I was there. Yet I stayed because I love him and he's my daddy. I had to cry sometime as I could feel my daddy slipping further and further away each time I left him and I visited him. It broke my heart when he did not seem to remember my name, but I knew that God knew his name, and so did I. It troubles me to see him now that he's slipping further and further away, and there's nothing that I can do to help him as he faces the fears of his own uncertain yesterdays and strange people and faces that he does not know. But the other day, Daddy called me by my name, that name that he called me when I was just a little girl. He remembered that name, and I could not contain the joy that I felt. If even for a brief moment we had connected on some level, God had given my daddy back to me, and we could really feel each other. I was there with him in the midst of his fears and confusion he was going through. It was not much, but it was joy to my ears when my daddy remembered my name.
That was a really powerful letter that you read us, Henry. I just wanted to take a moment to introduce myself. My name is Nicole Claggett. I am the Director of Community Development and Caregiver Support for Duke Home Care and Hospice. And I really wanted to just take some time to unpack some of your experiences that you've had, both in a pastoral role and also as a family caregiver. So one of the things that I've often read about is that sometimes the conversations around the future of a loved one in that caregiving journey is often not discussed in an African American family. Has that been your experience, and kind of what would be some advice that you would give those watching today?
Yes, oftentimes caregivers feel that they have nobody to turn to for help, and they'd rather take care of their loved one in the home than to put them in a nursing home. And sometimes the person really needs to be in a nursing home where they can get proper care. But because of this ways that African Americans have always taken care of their loved ones in the home, mm-hmm. they feel like it's really bad mm-hmm. to put a person in a nursing home. So they do it themselves mm-hmm. and find ways to care for their loved one in the home. And sometimes it's really detrimental to the caregiver.
Sure. And I think, quite honestly, maybe the elephant in the room is there has been a history of a lack of trust with healthcare institutions for African Americans, really based on facts of the way African Americans have been treated throughout this country.
For sure. That's why African Americans are very reluctant to get involved in any kind of research studies or anything mm-hmm. Dealing with hospitals. There is a lack of trust of healthcare facilities, so which really carries over to nursing homes even. So mm-hmm. that's a big deal with African Americans having trust mm-hmm. in those facilities.
Do you even find that in your work in the research center yourself?
For sure. Mm-hmm. That one of the things that we constantly are doing right now is finding new ways to challenge African Americans to become involved in research. And not only just to become involved, but also to maintain that involvement throughout the research studies. But part of the reason is that the researchers themselves don't give back to the community. And that's a real issue. People want some
Trust.
kind of something in return for what they give.
Yeah, I can only imagine, and really that sense of community is tremendously important for the African American population.
Yeah. And one of the things too is that they need to see people like themselves
Yes.
in the research, involved in the research. One of the reasons I came to Duke is because I had a facility with African Americans to help get them involved in research. When I came to Duke initially, there was like maybe less than 10% of the persons involved in our research were African Americans. Now there's over 25%.
Wow. So at least that's definitely increased. That's really good. So what about advanced directives? And I know that's another, that's a challenge across the population of the United States in general. People don't want to talk about what would happen if I get hit by a bus, what's going to happen in my last days of my life. I also know it's an even deeper, difficult conversation for the African American population. What would be some advice you would give?
African Americans have, again, a lack of trust because they feel that if they put out an advanced directive that they will be not treated as well. So they're really reluctant to sign advanced directives. They want the caregivers want maybe to get involved in advanced directives, but the patient or the care partner doesn't because they want to be cared for in the home by as long as they can, and that may not be possible.
Right.
That's why advanced directives are necessary.
Right. And how about hospice? Now I know that there are a lot of sort of myths out there about hospice, and I think over the last 25 years or so I've worked in healthcare, I'm really starting to see in some portion of the population some of those myths like hospice hastens death, or hospice means you don't feed a person so they starve to death, and that's a horrible experience. How would you?
Again, that's the lack of trust. Same situation because persons feel that once they go into hospice, that's a death sentence. So there's really a lack of trust about any kind of hospice situation.
What do you think we need to do as a country to help kind of foster some of that trust in some of these areas?
Well, again, when they see persons who look like them in those situations, in those institutions, it helps. When caregivers go into a hospital or a hospice situation and you only see white faces, it creates a lack of trust. So when in talking about it in situations like this, it's a good way to become involved with the caregiving and hospice and those kinds of institutions. The more we expose people to programs like this, the better it is.
And when we think about sort of your role in the pastoral sense and kind of in the faith communities, what do you think? I'm sure there are a lot of people that are participating in this virtual event who also are part of some sort of a faith community. What would you say to those watching today to really encourage them or to help foster some conversations? Because I think there is some natural trust in your faith community. And what could faith communities do to help folks in their caregiving journey?
Well, faith communities are very necessary, and the faith communities really have to work in partnership with the medical community. They need to see that happening. People need to see that happening on a day-to-day basis. As much as we can, we need to have medical practitioners and researchers come into the faith community and partner with them in order to develop programs that will meet the needs of the community.
And have you seen that working well in any particular congregation? Could you describe how that works? How you've seen it work?
Sure. I have, as part of the Alzheimer's Disease Research Center at Duke, we partnered with a program, a church actually, who we went to his church as researchers. We partnered with them. We gave them information, resources at the church. We also took blood pressure and other different kinds of things that we did with the community. They, in turn, started their own healthcare programs within the church. They had a garden, actually a little farm, small farm. They raised honey. They raised tilapia fish in a tank, and they took the food and the vegetables and stuff that they raised and passed it out to the community. And that pastor went with us to a research event and talked about what he did in his church. So we gave to the church, and the church gave back to the research community. Yeah.
Would you say, traditionally in Caucasian caregiving families, the caregiving, and I don't necessarily like this word, but they often say the caregiving burden, which depending on, and I've been a caregiver twice myself, typically falls on one person, typically the eldest daughter. Do you find that is also the case in an African American family, or is it multiple family members kind of working together?
Yes, definitely is one person.
Okay,
It falls
so
on one
same.
person.
Okay.
Maybe the elder daughter, but it could be the youngest daughter. But it's generally a woman, and it's generally one person. And one person is going to be out.
Yeah.
Like in my situation, my wife's situation, that is, her sister lived in D.C. and she lived here, and so she was close, and so all the caregiver burden fell on her, and her sister never really understood what was going on in terms of caregiving, and never understood the necessity of how my wife had to care.
Do you find that certain diseases like Alzheimer's are very, very private and that there's a stigma?
Oh, there's definitely a stigma with Alzheimer's disease because one of the first things that the caregiver patient was going to say, I'm not crazy, and that goes on, and they never really understand what Alzheimer's is, and so one of the first jobs that I had when I came to Duke was to educate the community about Alzheimer's so that people understood that it was a disease and that it wasn't something wrong with the person. It was a disease that could be managed. There's no care for it right now, but if we get involved in the research, perhaps one day there will be a cure.
So besides the feeling like I'm not crazy, what are some of the other typical responses that folks have when they get that type of a diagnosis?
Well, it's fear. That's the biggest thing, is fear. One of the things that I'd like to see is that African Americans become involved in brain donations. That's one of the ways that we can determine what's going on within the brain. And as I look back at our experience at Duke, about maybe 10% of the brains in our brain bank were African American. So in order to do the research that we need to do to find out why African Americans are actually experiencing Alzheimer's at a greater rate, we need African Americans to get involved in the brain donation program.
Can you speak a little bit about, some of the buzzwords that I think people across the country are hearing are things like social determinants of health. What does that mean as it relates to the African American population?
No, social determinants of health.
That's a big, but I don't think everybody understands it. It's sort of one of those buzzwords,
It
right?
is a buzzword, but for African Americans, every condition that exists, every health disparity that exists, we're at the bottom. So, when you talk about social determinants of health, we suffer disparate rates of every disease, whether it's cancer, Alzheimer's disease,
Diabetes.
high blood pressure, COVID.
I mean,
Yeah, so, you know, we suffer, we're at the bottom.
and why? What? I guess, can you help people understand what social determinants of health means?
Well, social determinants of health are those things that attribute to good health, or, you know, we often, because of maybe income, education, lack of opportunities, we don't get those choices that make us better able to take care of our health.
You hear about the food deserts, and
Yeah.
even when you go out into the rural areas, you know, you see a dollar, or not, well, maybe I won't mention the chain, but you'll see one of those sort of smaller, tiny little grocery stores, and all you have in there is the refined foods, the sugary sodas, everything that's processed,
In
and it's cheaper.
In African American neighborhoods, there are no grocery stores.
With
It's
fruits and vegetables,
yeah.
So I guess parting words for those who are participating today as it relates to kind of how to be successful in your caregiving journey.
How to be successful in your caregiving? Take care of yourself as a caregiver. You know, not you're taking care of a person, and what you do for that patient, or what you do for your care partner, is important. But you can't care for them properly until you take care of yourself.
Right. Thank you, Henry.